Basically, the interest as of now is on the JN1 variant, which is a offshoot of the Omicron variant 286. And the Omicron variants have been going on over the last year, 2023, 22, as we know. And they have been milder, they have been more associated with an upper respiratory infection. But the JN1 variant, which is the variant of interest now, is more associated with a body ache, headache, less of upper respiratory infection, like nasal symptoms are less. It is still mild, but there are some patients who are coming with which are known to come with a lung involvement. So this is what we are seeing. But currently, the knowledge is that it is still a mild illness, and it is still mostly taken care by patients at home and not requiring hospital admission. However, the numbers are gradually increasing. So this is what is being known currently. So the Omicron variant, of which the JN1 is again an offshoot, is very highly transmissible. So it is like very likely to spread rapidly in the population. So given that knowledge, this variant is still having milder symptoms. The specific symptoms which have been reported is headache, body ache, malaise, flu. Less of the patients have an upper respiratory infection or cold-like symptoms, like what we normally see with the viral URTI, sneezing, watering nose, which was more seen with the other Omicron. But there are some patients who are directly getting lung involvement as well. So they get this, they could get a lung flu or a lung pneumonia-like symptom, for which then they would need admission. They may even need ICU admission. So as of now, in Mumbai, in Delhi, the cases have just started increasing, and we really are not seeing that many of severe patients. There has been just one death reported in Kerala, but we don't know whether it is just only because of the COVID or because of the other comorbidities which the patient had. So we are, as of now, seeing less number of patients, and those who are there are still mild, and there have been no deaths reported in rest of the country. Precautions are still same as that for COVID. That is, avoid wear mask if possible if you're going crowded areas. People with comorbidities like elderly or those with kidney disease, heart disease, lung disease, malignancies, on immunosuppressants. These patients should not go out in the public much or go in crowds or just now we had that wedding season, and so many people have been exposed to huge number of people and people traveling. So these are all settings where there is a high likelihood for catching the infection. So this should be avoided. People should wear masks whenever they are going out in this high setting area. And most importantly, if a patient is having a respiratory illness, then we should stay at home and wear mask and avoid transmitting it to the others as much as possible. We are seeing much more of the flu and pneumonia infections than COVID. So the specific precautions would be to take a flu vaccination definitely, to take a pneumonia vaccination if you are in the high risk, that is if you are more than 65 years of age, or if you have any comorbidities. Wear a mask and avoid going in crowded places. And specifically to take an additional booster for COVID at this stage, that recommendation has not yet come. So today, regarding the COVID booster vaccination, Mr. V.K. Arora from the Genomic Society of India, he has not given any such recommendation. So as of now, there's no government recommendation to take a booster because this strain is new. We don't know if the existing vaccine boost will cover even this strain. We don't know how severe this strain is going to be. So as of now, there's no recommendation for that. But definitely take a flu shot, take a pneumonia vaccination, and avoid going in crowds. Wear the mask. especially in healthcare settings, in hospital, try and wear the mask as far as possible, or in any high risk situation. So these would be the specific precautions as of now. As we go more in the succeeding days and we see really how much of the illness is there, how severe it is, we will have a better, we would be able to give a better suggestion.